Good morning, good afternoon, good evening, good wherever you are. This is again Dr. Mizan with Dr. Mizan Coaching. And today we have a very thorough video on how to protect your medical practice. So if you watch any one video on our channel, watch this one, or at least watch this one first. I think I'm going to go ahead and put this on the front page of our profile page. So in this video, we'll have 5 tips, and this took me a really long time to basically collate because I have so many tips, and this is this is why we have a consulting service where we sit down with our clients and we basically go through everything and we educate them on just the entire medical legal space. And this really does protect your practice to a thorough degree, but I hope this video does a preliminary job. Okay. So there's 5 tips basically in this video, but before we begin, introduction. So who are we and what do we do? So again, we are Dr. Mizan Coaching or Mizan Coaching, and we are a team of physicians that basically help other physicians, or really doctors, nurses, MDDOs, PAs, NPs, etc. Anyone who wants to learn about the medical legal space, and also if you do run your own practice, or if you're caught in a medical malpractice case, then we are here for you to basically teach you what you can do about it. So number one, our goal is prevention, but once it happens, then we're here to help you out. And again, the reason why we do this is because, I was fortunate enough to enter the medical legal space, and I did my own private consulting for a while, where I would just teach hospitals and clinics and my own my fellow physician friends, and I realized that, most physicians don't know any of this stuff. So, it's not taught in medical school, it's not taught in residency, it's not even taught when you have a full-time position as a hospitalist or a clinician. So I took it upon myself to basically train other physicians and also just to spread this knowledge as far and wide as I can. So again, we do consulting, we work with individuals, we work with hospitals, clinics, residency programs, anyone interested in protecting their medical practices and pursuing justice regarding medical malpractice, personal injury, mass tort, product liability, and also with patients that believe that they were harmed. And if you need a doctor to sort of teach you this space, that's what Mizan Coaching is. And again, the only ask that we have is to please subscribe, click on the subscribe button, share this video with your other doctors and nurses, your friends and colleagues, because our goal here is really just to spread this knowledge. Again, we want this channel to basically be the medical legal space, on the internet, free of charge, obviously. Just a repository of what is medical legal and how do you protect yourself as a physician, because you don't want to lose your license over something silly, right? Okay, so without further ado, 5 tips on how to protect your medical practice. Forgive me if I talk forgive me if I don't talk enough about these things, but I tried to keep it very short and simple. So tip 1, no medical legal terminology. So basically the 4 that I think are the most important, and there's a whole book that I can write about this, but the 4 that I think are the most important are standard of care, causation, delay in care, and subpar care. And these are just things that some of these I just made up on my own. So what is standard of care? So standard of care basically means what would 90 out of 100 doctors or nurses, whatever, right? I'm just going to say the word doctors, but it means everyone. So what would 90% of doctors do in a particular situation, or when prescribing, for example, for a female with a UTI, what's the standard of care? Now based on USPSTF guidelines and up to date and blah, 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 it's yeah, you can just remotely call in a prescription of macrobid or a cephalosporin, right? So the standard of care right now is you don't even need to examine the patient. This is very different than it was 10 years ago, where no, every patient who is getting a prescription needs to be seen in a clinic. So know the standard of care for what you are doing. So for surgeries, this is pretty simple. It's how would 90% of surgeons perform a specific surgery, right? For us, general medicine doctors, it's a little bit harder, I would say, because, no 2 doctors are the same, and but really there is an average of how things are done, what medications are prescribed, etc. So for example, like, what I wrote here is like a fall case. So let's say that a patient fell in the hospital, and I've had hundreds of fall cases. But for example, let's say that your grandma falls in a hospital. So if she had a fall risk before, then she should be on high fall risk protocol. If she's not on high fall risk protocol, meaning like, close monitoring by a nurse, alarm, like having a bed alarm, having, etc., like having non-slip socks, etc., that would be a breach of the standard of care, that they didn't provide those things. Okay, next is causation. So causation is pretty simple. It's like, can a, for example, like a med mal attorney link an injury to a, or rather a finding to an injury? So let's say that a doctor mistakenly prescribes one antibiotic known to cause like Achilles tendon rupture. That clinical pearl right there, to all you med students, figure out what I'm talking about. So let's say that like they prescribe some antibiotic that can cause Achilles tendon rupture, and it does, and they had the opportunity to prescribe a different antibiotic because there was no reason to give that one. So then what would you say? You would say that there is a direct causative element or direct causation, because the doctor could have used something else, but there is causation between these two events. The third thing is delay in care. So make sure that, don't be slow with your patients. Remember that these are people, these are humans, these are your brothers and sisters. So don't delay in care, do things fast. Because of 1 hour, and it depends on the specialty, right? But like us family medicine outpatient docs, it's like, 1 week, 2 weeks. If you're an ICU doctor, seconds matter, right? Okay, and the last one, so an example for that is like a delayed lung cancer screening. So if a person has a smoking history, if they're above 50, if they're, etc., they should be getting annual CT chests, right? So let's say that, you forget or something, or you don't ask or whatever, and then boom, like the next year they find that they have some sort of lung cancer, like small cell or an adenocarcinoma, right? So then they can say that, like, yes, like the doctor had a delay in care, that they didn't do what they were supposed to. It led to a delay. If they caught it sooner, the prognosis would have been better, etc. Okay, and then finally, subpar care. So like I get so many of these cases and I just shake my head, because it's like, we're doctors, right? Like we should hold ourselves to a very high standard. So so basically it's like, for example, like a 10-year-old kid with abdominal pain, and then the ED provider, usually it's, PA or NP, or sometimes it's MDs or DOs, like, they just say, oh, it's just acute gastroenteritis, it's just food poisoning. And they just send the kid home, but they didn't rule out acute appendicitis. The kid, ruptures, the kid becomes septic, dies like a day later. So that's due to a poor differential, right? Okay. So second tip is to document everything. And we have a very thorough video on this. Please check it out. Please check it out, because that'll protect you. But document everything. So write event notes when things happen. If a nurse or a consultant or whatever, or a colleague is refusing to take care of a patient or refusing to see a patient, write that down, right? Write it in a diplomatic way, because you have to protect yourself first. And then also write justifications for any major or abnormal changes. So, if you're switching like a diuretic or something, like just put a little blurb, like changing Lasix to this because of this, right? Easy. Tip number 3 is to CYA and own up to mistakes. And, we'll have a whole video on this, but basically cover your behind. And if you do make a mistake, it's better that you catch it and just write an event note saying, oh, like, I should have done this, but today I called the patient, made sure, patient was aware that this happened, right? Mea culpa, like, my mistake, own up, you're an adult, you're a professional, move forward, right? You don't want your legal team to be like, hey, doctor so-and-so, why did you not do that, right? So, okay, tip 4 is do not do a half a job on anything. So what I mean by this is write thorough notes, so write thorough SOAP notes, do not copy paste physical exams, present thoroughly to your team, and don't just go home and leave until your job is actually tidied up and finished. And we see this a lot in more rural centers, but like, sometimes in city centers where doctors just kind of do the bare minimum and then they just go home. Just remember that these are people with lives and families, and if you do something like that and something falls through the cracks, you have no one to blame but yourself, right? And it's very difficult to defend a case like that, if not impossible, right? So and the most common mistakes occur during handoff, so be sure to use iPass or another method to ensure that pertinent information is being transferred to the next provider, the next nurse. And also, like, I didn't write this in my notes, but have interdisciplinary meetings. So like IDT or whatever, like every hospital has a different name, but like, talk to your nurses, talk to your case managers about your patient list, your census, just so everyone is on the same page. And finally, the last tip, and really, like, I would say, because I'm biased, but like the most important tip is to consult with a medical legal team if something goes wrong. Don't just run around scared and stuff. These things happen. Like if you watch our other videos, like, 100% of physicians will get sued at one point or another in their career. And by sued, I don't mean they're the primary defendant. You could be just a named defendant. So so consult with a medical legal team if in a legal battle, if you're named in a lawsuit, in a medical malpractice case. Work with your employers, meaning your hospital's legal team, and consult a medical legal physician who you trust and who can guide you through the entire process. For example, like deposition prep, because depositions are scary. I've been in them. Like, they're extremely nerve-wracking. So it's better to talk to someone like myself or the doctors on our team at Medical Legal, at drmizan Coaching. Our email is in our profile page to contact us, where we can basically teach you like what to expect, how to be strong and give, adequate, optimal answers in depositions, but also how to review your own chart, and also just general medical legal education. Because again, like, knowledge is power, and the more you know, the more you can protect yourself, your practice, your livelihood, your family. Yeah, so these were the 5 tips. I went through them pretty fast. If you have any questions or comments, please comment below, and please, again, subscribe and really share this video, share it with all your physician, nurse friends and family. And also the other thing, and this isn't really in this video, but drmizan Coaching or Mizan Coaching, we also help patients. So if you are a patient or you have a family member or a friend that you believe was hurt or did not receive adequate treatment, reach out to us. Like, we're happy to help as well. All right, well, again, this is drmizan, and until next time, and thank you, thank you on behalf of the team for watching our video, spending time, and this really is a passion project, so thank you again. All right, take care.